am Jerry with Medicare Options for You. Thank you for joining me for another one of our Medicare informational videos. Today we'll be talking about Medicare 101, what everyone wants to know. Join me for the next couple of minutes for this brief overview of Medicare 101. I will also be introducing a two-page flyer that we offer through my office. This flyer actually contains abbreviated version of this presentation. It has all the information you really need to know for like a Cliff Note version of Medicare 101. This is a free flyer that we provide. So if you'd like one, just either email us at Medicare at geedaniel.com, or you can call the office at 831-920-3536, and we'll make sure to either email this or send it out to you. All right, so let's go ahead and get started with our presentation. I think what I'll do first is I'll go ahead and show you what the flyer looks like. So this is the flyer. It says Medicare 101. And yeah, it just has an overview. It talks about, the things that you'll need to know that we'll cover today, right? What are the different parts of Medicare? What is Medicare? What is covered? When Medicare, what does it cost? What are some of the costs and when can I enroll? So it's a great little handout. Again, we'll provide it to you at no cost. Just let us know that you'd like that, okay? So now let's look at Medicare 101. Now, my name is Jerry. I am one of the agents here at G. Daniel Insurance Agency. Medicare Options for You is the Medicare division of G. Daniel Insurance Agency. We are a health insurance agency. We focus on health insurance. And also in the office is my son, Caleb Daniel. He is also licensed and trained in Medicare. So we are a family business, and we will be here for you today and tomorrow. And our motto is every customer is important. So please, we would love to assist you as your local Medicare insurance agency. And we are local to the Monterey Peninsula here in California. Okay, so what will we be discussing today? Welcome to Medicare. We're going to look at a couple of things. What is Medicare? What are the different parts of Medicare? What do those parts cover? How much does it cost for those parts of Medicare? And we'll also look to see when can I enroll or when should I enroll? Okay. All right. So we're going to start here with what is Medicare? Medicare is a health insurance program. It says it's available for those 65 and older, or for those younger than 65 with a qualifying medical condition. That medical condition has to be deemed some kind of a permanent disability by a medical professional. And then once you apply to Social Security and you are awarded Social Security disability, after 24 months of disability, you will automatically get Medicare on the 25th month. For everyone else, when you turn 65, you are available. It's available to you. And in reality, unless you have employer-based coverage, Medicare is your insurance, because there really isn't any other options within the individual health markets for someone that's over 65. All individual health that I'm aware of, it really ends at age 65, just for 64 and below. So that's what Medicare is. Now, it's not free. We'll talk about some costs in just a minute here. And it does require you to enroll at specific times, and we'll also discuss that. Or you may have to pay a penalty. We won't discuss penalties today, but we will at some point. So what are the parts of Medicare? Well, there are four main parts we'll discuss today. Each part covers a different area of your health care. That makes it somewhat simple to understand. And in addition to the parts of Medicare, there is something called a Medicare supplement or a Medigap plan. That's also, for many people, part of their Medicare options, the options that we provide. So we're going to look at parts A, B, C, and D. And for that, I'm actually going to jump back over to this handy guide that we have. Okay, so we talked about what is Medicare. Now, what are the different parts of Medicare? Well, let's look at Part A. Part A covers your hospital insurance. I like to say it is inpatient, because you really have to be admitted to the hospital for your Part A, um, to cover those charges. And let's see, it also covers skilled nursing facility. Again, when you're admitted there, hospice, surgery, and certain home health care. So that's what your Part A covers. We call it hospital because it's primarily hospital insurance. Part B, on the other hand, is your medical insurance. So this covers everything if you're not admitted. So things like doctor visits, specialists, lab tests, diagnostic screening, medical equipment, emergency room, ambulance, transportation, outpatient services, those are covered under your Part B. And just as a side note, Part A and B is what we call original Medicare. That's what you are covered for when you have Medicare. Now, what is a Part C? Part C is actually a plan offered by private insurance companies. It's an alternative to original Medicare. You will still have your Part A and your Part B coverage, but a Part C combines those. Oftentimes, you'll also get Part D coverage, which is your prescription drug coverage, and then there might be additional benefits. If you have ever noticed on TV, they'll have these advertisements that says Medicare beneficiaries. You can get this plan. It costs zero to see the doctor, zero to see a specialist, zero for hospital. You pay nothing, it says. It also includes vision and dental. Most likely that was a Medicare Advantage plan. They do vary by location, and because they vary by location, they can also vary by cost, by what's included, various different factors. This is why you want to work with a broker like myself, because we can help you understand which Medicare Advantage plans are in your area. We can help you do some kind of analysis to see what might be a good fit for you. But that's what a Part C is. Part D is your drugs, your prescription drugs. Your normal monthly prescription drugs are not covered under Parts A or B. You would get that under your Part D, so you'd have to get really one of those. And lastly, the Medigap plans, they are supplemental plans that are help to cover some of the costs that that Medicare does not cover. All right. So let's go back to the presentation. So we talked about the 4 parts of Medicare. Now let's look and see how much does it cost. We're going to look at a couple of things. We're going to look at deductibles. Your parts A and B have deductibles. We're going to look at the co-pays or the co-insurance, and we're going to look at what the premiums are. Before we get there, just as a general note, co-pays are where you have to pay a dollar amount. Let's say $20 for this or $50 for this. Co-insurance is always going to be a percentage, like 80% covered and 20% isn't. Okay, so for look at costs, let's go back to our handout, and we'll look at costs, right? So let's look at Part A. Part A has a deductible per benefit period. What is the benefit period? It is 60 days. So if you are admitted to a hospital and you have Medicare, your Part A will pay for the hospital portion of your stay. It will cover everything relating to the hospital except for the doctor portion, the doctor's bill, which is covered under your Part B. Okay, so you can stay up to 60 days. You pay nothing for that stay, but you do have a deductible, $1,484. And then you can stay up to 60 days. If you stay longer than 60 days, there are daily fees. I've listed them on the screen. You can go back to the video again and see where those are. You can call me and I can explain in detail to you. Okay. Now, Part A has no premium. Really, you've already paid for your Part A. So there's no monthly premium that you have to worry about when you're using your Part A benefits. Part B, however, does have a premium. The standard premium is $148.50. And by standard, that applies for individuals if you're single, if you had made less than $88,000 average income within the last 3 years, then you would pay the standard rate. If you're married and within the last 3 years, your average income, reportable income that you pay taxes on is less than 176, then yes, you'd pay the standard amount of $148.50 a month for your Part B. If you made more than those amounts I just listed, you will pay an additional amount called the income related monthly adjustment amount. So instead of 148.50, you'll pay a higher amount. That's determined by Medicare. Okay, but those are the premiums. Now, what does Part B covers? It covers basically 80% of all of your doctor or your medical costs that Medicare would approve. 80%, you have therefore a 20% co-insurance flat across the board. One thing to note on that 20%, there is no annual limit. That baby can just keep going higher and higher. That's why we will discuss options to mitigate you having, a $20,000 bill for your Part B portion, things like that. Part B does have a deductible. It's $203 annual deductible. Now, in addition to Part A and B, let's go ahead and switch back to this here. Then, your Part C and D, they all vary. I mean, they really, really vary. They vary by location. They vary by the company that is providing the services. So really, it's really hard to say. Even the Medigap supplements vary. Your Part D vary. It could be either as low as $10. It could be up to $100. You really just want to work with a broker like myself and let us help you to understand what is covered on there. Okay. Now let's look at how can I enroll? Well, there's a couple of times when you really want to make sure that you can enroll. For people that's turning 65, you have a 7-month window. You can enroll anywhere between 3 months before the month of your 65th birthday or 3 months after. That's called your initial enrollment period. In fact, let me switch over to this again. And let's go down as far as when you can enroll. So that's the initial enrollment period, 7 months. You really want to do this. You really want to make sure you enroll in time because there are some penalties. If you miss the window, you have to wait until the next open window, and that could cost you financially. It could also mean that you're uninsured. So please give us a call. Let's make sure we are assisting you with making sure that you have the right information. You can enroll in time and things like that. Now, there's some other enrollment periods I want to mention briefly. There is the annual enrollment period. That's October 15th to December 7th every year. This is a time where you can sign up for a prescription drug plan, a Part D. You can sign up for a Part C. Or you can make changes and things like that. So that's every year. You have an open window to do that. There's also an open enrollment period if you have a Medicare Advantage from January 1st to March 31st of every year. You can make a one-time switch if you want to go from one Medicare Advantage plan over to another, or maybe you want to leave your Medicare Advantage plan and go back to original Medicare and a supplement. You can certainly do that. We also have what's called special enrollment periods. Special enrollment periods apply for, let's say you're moving from another state to California, or you live in California, but you're moving from one county to the next county. Well, you have a special enrollment period because if you have a Medicare Advantage plan, that Medicare Advantage plan may not be covered in the new county or the new state. So you have to get a new one, and they give you, generally speaking, a 60-day window. Generally speaking, a 60-day window. Okay, let's say you get admitted to a long-term care facility or a skilled nursing facility, then you may have a special. Then you will have a special enrollment period where you can maybe change your plan that's more suited for the long-term care. If you're currently insured by your employer, so you delayed your Part B, if you lose that coverage or you elect to discard that coverage, then you'll have a 60-day window to sign up for Medicare. So just some things that you'll need to know in order to make sure that you maintain that. Okay, so we talked about special enrollment periods. Do I need Medicare? I want to cover just a brief number of things. If you are a U.S. veteran, if you have the VA health insurance benefits, you certainly do need Medicare because the VA or TRICARE will assume that Medicare is primary and they will cover secondary, which would be the 20% and things like that. What if I have Medi-Cal or Medicaid? Yes, you still need to get Medicare, same thing. Medicare will be your primary coverage for you under those circumstances. Everyone else, you really just need to sign up for Medicare because that will be your insurance. Okay. All right. So hey, let's do a little recap. I talked about what is health insurance, what is Medicare. It's health insurance. We talked about the different parts of Medicare, A, B, C, and D. We talked about what each covers. We looked at some costs. We looked at deductibles and co-pays and co-insurance. And we also discussed when can you enroll in a plan. All right. So you can get more information. This is my contact information. I will leave another page, however, that's going to give you more updated information on how to get a hold of us. Hey, this is it. This is Medicare 101. We just wanted to share this with you. Let me go to this screen here. Give me 1 second. Let's go back to this. All right. Okay. All right. So thank you for joining me for Medicare 101. If you have questions, reach out to us. We love to answer your question. We love to assist you. Be well, be safe. I'm going to put up one more screen that will give you some updated information on getting a hold of us by email or phone. And until then, be safe and be well. All right. Thank you.